Welcome. This is Katrina Wu, and this week we'll be talking about integrative medicine. I think it's fitting that we're devoting an entire week just to covering this topic. To begin with, it's just really broad. And even putting this lecture together is hard because there are full doctorates on small portions of integrative medicine. So this will be a basic overview, but it's definitely a conversation worth having for a few reasons. First, it helps us understand what our patients are doing. So if they come to us and are letting us know what else they're doing to help treat their symptoms, because certainly with complementary and alternative medicine, a lot of those can be patient-directed. It's helpful for us to have a sense of how that fits into the broader picture of their health. It also helps us know how we might be able to supplement what we're doing with traditional Western medicine in order to better treat our entire patient, our whole patient. So by that I mean not just her physical symptoms, but emotionally, spiritually, and physically beyond perhaps her initial symptoms as they present. So it helps us provide more holistic care. And then finally, as healers ourselves, we need to figure out how to take better care of ourselves, and especially for midwives, burnout is a big issue. And whatever we can do to promote our own health, let us tap into that so that we can better care for those that are in our care. So you'll see as we go through these different modalities of healing, you might have methods that you choose to add to your scope, areas that particularly interest you, and as you move forward as a practitioner, you devote extra time to learning about and incorporating it into your practice. And then other areas you may feel like it really resonates with you and your understanding of health, but isn't really something that you could easily accomplish. So it's something that you providers that you typically would refer to. So maybe that's a chiropractor, an acupuncturist, for example. And then there might be modalities too that don't necessarily resonate with you, and that's okay too. And to realize that integrative medicine is really broad, and it's not like you have to take all of it or none of it. All right, so let's go ahead and jump in here. So complementary and alternative medicine. What is it? So basically, we can divide it into 5 categories, and you'll see that some of these could overlap. You could put them in multiple categories, but it's helpful to at least have a basic framework when we start to talk about complementary and alternative medicine. By complementary, I mean something that you're adding to traditional medicine, and by alternative, I mean maybe something you're doing instead of or in place of traditional Western medicine. And that term is still widely used, and it's slowly being replaced with integrative medicine, which is a little bit more holistic. So we'll talk about that in a minute. So mind-body medicine, that can be everything from yoga, tai chi, meditation, prayer, forms of art therapy, dance therapy, music therapy. Guided imagery would fall under this too, hypnotherapy. So all of those would fall under the umbrella of mind-body medicine. And then there's manipulation, which would include chiropractic therapy or care, massage therapy, craniosacral therapy. And then we have got biologically based products. So by that I'm talking herbal tinctures, maybe botanical flower essences, which also sometimes get lumped under energy therapies. Any supplement would fall under this category as well, so vitamins and things like that. Then we have energy therapies, which would include reflexology, acupuncture, Reiki, different forms of healing touch, basically. And then whole medical systems, and by that I mean not just one avenue for health or one aspect of health, but really an entire system to explain health. So for example, with traditional Chinese medicine or TCM, they have a whole process for how you assess a patient, how you diagnose a patient, and then what that diagnosis looks like would lead to different types of treatments. And that wouldn't be our same process. So looking at that. as a whole medical system. Ayurveda is that way as well. Homeopathy, to a certain extent, can be that as well. So integrative medicine, by integrative medicine, I mean that we're using both traditional biomedical techniques and we're using CAM in a way that addresses the whole person. So easily and fluidly integrating all of these aspects to address the woman that's sitting in front of us. A lot of these methods are coming out of China and India. So I think that's kind of helpful to know. And they've been around way longer than traditional medicine, which I also think is helpful to know and to realize, like when my husband, when he graduated medical school, they all wore green robes because green is the color of plants, and that's where a lot of our medications originated from initially. And so that history is there, even in our own traditional Western medicine. So who is using CAM? So the National Institute of Health, or the NIH, says that about 38% of Americans use some form of CAM, and it's on the rise. It's been trending up for quite a while now, and the highest use is in white women, particularly under the age of 65. The last thing I'll say for this slide is just that what makes it non-traditional really does depend on what country you live in. So in the U.S., these are non-traditional forms, some of them on the rise to where they're just about mainstream, but there's plenty of other countries where these would be the primary form, and you wouldn't refer to it as CAM because that is the mainstream form of healthcare. So here it's CAM because it's not used as integral to standard medicine. So, okay, so then just before we fully kick off here, I just want to go over a few different organizations that kind of help inform us, and that will be helpful for you guys moving forward into practice for where to find your answers. So the first one is the National Center for Complementary and Integrative Health. That used to be the National Center for Complementary and Alternative Medicine, so you might still see the NCCA like in your textbooks. I think that's the acronym they were using, but currently it is the NCCIH. And then the Office of Dietary Supplements. Both of these are groups under the NIH. They both provide basically all the funding for CAM clinical trials in the U.S., which go to about 6 different research bodies primarily. Most of those are in universities. So these are the two groups that really are funding all the CAM trials we have. And then they're also committed to disseminating CAM research to professionals, so that's where we come in, that we can get a hold of the studies that have been done, as well as to the public. So they're probably your best source of information currently. And then we've already discussed this some, but the FDA does not regulate the safety and efficacy of, and now I'm talking more so about botanical medicine and herbal medicine. So they're not regulating safety and efficacy the same way they would pharmaceuticals. So all of herbal medicine would be considered supplements, and thus the FDA is only regulating marketing and sales. So that affects what the labels can say. Like they couldn't say that it's going to treat a urinary tract infection, but they can say that it would improve urinary health. They can't say anything about diagnosing, treating, curing, or preventing any disease. So you're not going to see those types of labels on anything you're getting over the counter that would be an herbal supplement. And then the United States Pharmacopoeia sets the standard for all prescription and over-the-counter medications. And they're not a government organization. It's a non-governmental public health organization. And really what they're doing is they're verifying quality, strength, purity, and consistency in a medication, or I'm sorry, in a supplement. And so if you see that there is a USP verified dietary supplement mark on a brand, then basically that gives you some reassurance that there's consistency in what's in there, that the quality and the strength and the purity of what it says is in there will be in there. So I think about what medications are we recommending, what brands are we recommending to our patients, or if we're telling them to go get probiotics, or we're telling them to go look for black cohosh. Can we provide some direction for them and some safety around that in terms of making sure that they get a quality product? So that's where USP comes in, and where our due diligence and doing a little research comes in for what we recommend. And then this isn't an organization, but the German Commission E is just worth mentioning here. Basically, in Germany, they had this big database where they had 380 different graphs that outlined all the safety and efficacy of a bunch of different herbal products. And that really was the gold standard for a long time, but then they disbanded in 1985. So it's not current or fresh anymore. You know what? I'm just realizing right now that should be 1995. That's too old. So still not current or fresh, but nothing new is coming out on that front. So they disbanded in 1995. And then the other downside is that it's translated from German into English, but in the translation we lost all the citations and the dates for each of the herbs. So it's useful to a certain extent, and you'll still see that being kind of the gold standard for what research we've got accumulated on certain products. But just so you know that it does have some limitations. So lastly, I just want to put this before us as we start on all of this. If the research is inadequate, convey this to your client, but don't automatically dismiss the potential benefit of the therapy. So we've got a lot of CAM research on the front lines now, and more is starting to come in. We've still got a long ways to go. But just because it hasn't been heavily researched, that doesn't mean that it might not hold some benefit for your patient. All of that within the context of having a sense of safety and risk and all of that. But just to completely dismiss products that have been passed down and seemingly worked from a anecdotal standpoint would be a loss if we were to just completely dismiss it. So we'll go in with open eyes and we'll see what we get. Okay, so we're going to go through each of those categories. So I'm going to start with manipulation. So, oops, did I go too far? There we go, manipulation. So that's our massage therapy, chiropractic care, Mayan abdominal massage, craniosacral therapy. So manipulation, massage therapy. It's probably the most popular and widely available form of complementary and alternative medicine currently available. We know that it's good for relaxation, but what else is it good for? There's been a few studies done with preterm infants, particularly in newborn massage, helped them with weight gain, so that's kind of interesting. That was statistically significant. Fibromyalgia, it helped with a number of symptoms. So there's a handful of studies in women with fibromyalgia. So anxiety, sleep, pain, general quality of life. Faster recoveries in hospital settings for hospitals that provided massage therapy. So quicker discharges. Anxiety, certainly. Blood pressure, chronic pain, PTSD. There's actually paintings in Egyptian tombs that showed people being massaged. And in China, it goes all the way back to 2700 BC, discussing it as a treatment. There's even records of Julius Caesar saying that he was getting daily massages for neuralgia. So it's been around a really long time. So then contraindications. Cancer that's not in remission, you should really I would leave that in the oncologist's hands in terms of whether or not that would be appropriate. Certainly could be helpful, but is definitely a caution point. So cancer not in remission. That'd be an example to maybe consider something like healing touch, which we'll talk about later, that can involve even not touching. Thinking about pregnancy, if you've got a woman with a lot of risks already for like a DVT, calf and ankle massages could potentially release a clot or potentially induce somebody. Though I don't put a whole lot of stake into that, but potentially there's acupressure points on the inner part of her calf, kind of above her ankle. And And if you've got a uterus already on the tipping point of having a baby, then that might help get things going. But for somebody that's not at risk for preterm labor, you're probably fine. And then the other thing to consider would be if there's essential oils that are being used alongside the massage therapy, making sure that those oils would be appropriate for your client, whoever that may be. So if she's pregnant, that she's letting her massage therapist know, and then they should be able to speak to what would be appropriate or not appropriate in pregnancy. Other forms of manipulation, chiropractic care. So any kind of form of pain, headache, back, neck, sciatica. And then more specifically to our work, ideal hip alignment for birth. I would, the rest of this for chiropractic care, I have yet to see good research out for, but anecdotally I've seen it a lot. And working with chiropractors, they see it a lot. And maybe I just haven't found the research yet, but I think every pregnant woman would be serviced by seeing a chiropractor at least once towards the end of a pregnancy, just to make sure that our hips are in good alignment so that baby can just drop right on down. I've seen them also work wonders in labor. So say you've got a baby that's say OP and is presenting face up instead of face down, for example. They can do work in labor to help adjust that. Or maybe the baby's head just isn't descending very well and it's causing really an ineffective labor pattern. Chiropractors could be helpful in that setting as well. So if you're in a birth setting where chiropractors can be called in labor, use them. And then the other thing that they can do that you might run across are latch issues. So baby's head and neck go through quite a bit on the way out, and sometimes they come out a little funny. So I think about babies when they're first trying to latch and they're really not sucking or drawing the nipple in. It's more like they're just kind of biting straight down, especially if after a day or two their heads are kind of tilted to one side more. So I see that, or I see with the latch issues, either of those. I think that's helpful to send them to the chiropractor or craniosacral therapist. Same thing. Craniosacral therapist for labor too. I would say, yep, everything we've got so far here, you could also send somebody for craniosacral therapist if you're lucky enough to have one in your community. And then reflex and colic are other things chiropractors can work on newborns for. Mayan abdominal massage. It's basically, say you've got internal organs that are slightly shifted. Mayan abdominal massage seeks to reposition reposition those organs to help improve blood flow, nerve flow, and chi flow. So it can look like what you see up there with a woman manipulating that woman's stomach. It's pretty gentle. It's not painful, and they tend to also teach women how to do it themselves. So a lot of these women go home and then have their own routine for self-care, for self-massage. But then it can also look like a bimanual exam meets a massage, where they've got 2 fingers in her vagina and 1 hand on the outside. And I'm thinking specifically of repositioning her uterus. So we say in traditional Western medicine, it doesn't matter which direction your uterus is facing. Mayan abdominal massage would say, a retroverted uterus could cause some issues. We're more likely to have some back pain during our periods, and we're more likely to have some brown bleeding before our first period starts, and then maybe a longer couple days of brown bleeding after our main menses is finished, and we would consider that to be abnormal and something that we could treat. And by repositioning the uterus to ultimately be more anteverted, how they manage to do this, I am not a Mayan abdominal masseuse, that improves things like dysmenorrhea and even infertility. So if women are having a lot of abdominal pain or GI irregularities in general, or dysmenorrhea or infertility, if you have a Mayan abdominal masseuse in your community, and that's the sort of thing that would be appealing to your patient, that would be something you could consider recommending. I have not personally seen any randomized controlled trials or a lot of research, but just to know that it's out there and available. I have just a few seconds worth of the video here for those of you who haven't had any exposure to chiropractic care, to just get a little taste for what it can be like. Some just use their hands and their bodies for everything they do. Some have some tools that help. Some of them have tables that shift down to counteract the cracking that's happening on top if there is cracking. So this is just so you can have a sense of what it looks like.
And then all the way out. You're going to push right through here, and you might feel a little crack or pop. Good. And over toward me, and you might feel that crack or pop along the low back. Good.
Put that left ear over just a little bit more. Good movement. Big breath. And out. Slow you down. Good job. Okay.
So you can get the idea there. Chiropractors have their doctorates. Mayan abdominal massage originated, oops, I'm on the wrong slide, originated among the Mayans in Central America, and generally speaking, all the trainings around it are carried on from somebody who's had very specific training for it. So that is certainly something that you could add that probably wouldn't take very long to add if that was something that was interesting to you and you wanted to add it to your scope. Okay, moving on to biologically based products. So I've got herbal medicines and supplements, botanical flower essences, and aromatherapies. And those latter two aren't always classified this way, but I thought that would be the easiest way to go through it here. So first of all, traditional versus pharmaceutical. So when we're talking about herbal preparations, traditional preparations would use the whole form. So if it's the flower that's known to have the beneficial effects, it's the whole flower that's being used, or the leaf, or the bark, or the root, or whatever it is. So there's no extracted or concentrated active ingredient. Because of that, it's pharmacologically weaker. It works more gradually. There are generally fewer adverse reactions. And you might need several components within, say, the leaf or the flower that kind of work synergistically in order to have a good effect. And it could be that in order to get that synergistic effect, it should only be picked at certain times of the year or it won't be there. So certain seasons can mean varying potencies for when you harvest it, and because of that, there can be a lot of variability if you're getting it over the counter. Say you're getting teas in bulk, that could be a pretty different product, a tablespoon of this leaf versus a tablespoon of that leaf, in terms of exactly what you're getting. So there is quite a bit more variability there with traditional forms. And again, you can see here, Okay, so then pharmaceutical, that would be if we've extracted an active constituent from it and then turned it into a drug. So I think of digoxin or senna for constipation. Those are examples of where we've extracted the active form and concentrated it. So you're going to have like a maximum effect, but you're also more likely to have side effects as well. Okay, so then formulas. You can see these in a lot of different forms. You could have teas, which teas could be ones that you ingest orally, or it could be that you've concentrated a bunch of rosemary and calendula and lavender in hot water and then waited for it to cool, and then you sit your bottom in it because you're recovering postpartum, and that's all going to be really good for skin integrity, healing, and soothing. So you could use it that way too, or put it in the bathtub. It wouldn't just have to be a sitz bath. Capsules, that was straightforward and obvious that you're swallowing. Or you could insert rectally. You could have a suppository too. Ointments or creams. I think about pregnancy belly oils would be a good example of that too, where maybe you've steeped some different types of, or melted down some different types of body butter, coconut oils, that kind of thing, added rose and lavender and then ultimately strained them out. And then you've got an ointment that's, or not really an ointment, an oil that would help with stretch marks, things like that. Tinctures can be extracted into alcohol. So tea, same thing. You could have it in water with all of the leaves and the flowers and have it in a sunny spot for 2-3 weeks and then ultimately strain it out. So things like water and alcohol can help pull the properties out of your product and then can preserve it that way. So drug interactions, just to touch on it, anytime you're recommending anything, whether it's herbal or pharmaceutical, we should have a sense of what potential risks would be. So I bring these ones up because these ones are particularly known for interacting with a lot of different things. So for, let's see, all the way up to kava, ginkgo, St. John's wort, ginseng, garlic, so the G's, all of those are going to interact with warfarin in different ways. So I think about if you've got anybody with a long medication list, then you got to look this up. Really any medication list, but you got to look it up for interactions. And if you're fine, then you're good to go. But if not, then I would steer clear. Same for hepatic toxicity can be a concern among a handful of herbs as well too. So just to make sure that you understand what it is you're recommending. Okay, and then when I think about herbalism as a field, there's basically 3 different realms that can be broken down into. So one would be Ayurveda, which we'll talk about in a little bit, but that's like an ancient Indian tradition, and it's a whole system tradition, but they utilize a lot of herbs. So that would be one system with which to utilize herbs in a different way to think about disease and health and wellness. And using herbs accordingly. Another way would be Western botanical medicine, which is probably more what we would be familiar with. That would be what naturopathic doctors would be utilizing. So that same process for how we assess and how we diagnose is the same. So then you would say, I'm using uva ursi to help treat this UTI. As opposed to traditional Chinese medicine, they might have what we would call a UTI, but they wouldn't think of it as a UTI. They'd think of it as like a certain disruption in different types of energy flow. I'm not explaining that very well. And it would have a different type of herb to address a problem that's ultimately a different type of diagnosis than what a Western traditional practitioner would utilize. But you'll see herbs used heavily in these 3 different groups. So I just bring that up. So if you're talking about herbalism, it could be any of those areas. And then just a little plug, if herbal medicine is an area that is particularly of interest to you, Aviva Ram is a famous herbalist, midwife, and doctor who has a course on women's herbalism for women's health. And it takes most people around 2 years to complete it, but you just completely do it on your own time. It's online and with textbooks and things, and so if this is an area that's of interest to you, she'd be a great resource. So that's Aviva Ram, R-O-M-M. Okay, so what I'm going to attempt to do here is the next 2 slides, I'm pulling what we actually have a pretty good, decent research that would warrant recommending different types of herbal products and supplements for different conditions. So this is my evidence-based medicine section. So if you see it here, I'm speaking to decently strong research. Okay. So for PMS, calcium's got good research. Vitamin B6 has good research. And this is for the whole slew of PMS symptoms. So bloating, moodiness, menstrual cramps, breast tenderness. So, and then chasteberry would be the last one for PMS. And that's particularly good for breast tenderness, whether it's cyclic, so it's linked with her cycle, or whether she's just continually got breast tenderness. It's called chasteberry because when they were initially figuring it out. If they gave it to men, it decreased their sexual desire, so that's why it's called chasteberry. They think that chasteberry works by decreasing prolactin, which then reverses the normal luteal phase suppression of LH, and then allows for like a fuller corpus luteum that ultimately yields more progesterone. So that the higher levels of progesterone would then help with the PMS. Somewhat makes sense to me physiologically. So anyway, that's the proposed. And then there's been some research with it for PMDD too, and that was also helpful. So premenstrual dysphoric disorder. Okay, then moving right along. Vitamin C and then chasteberry, which the other name for chasteberry is Vitex, is also linked with being helpful in infertility. And then nausea, vomiting in pregnancy, you're already probably familiar with these, but vitamin B6 and ginger both have a good amount of research behind them. And ginger, they can really take it all day in any form they want, whether that's ginger ale, sucking on hard ginger candy, taking ginger capsules, drinking ginger tea, cooking with ginger, just continuing to get ginger in can be helpful. And we've got a number of randomized control trials to back that up. And then I think it's helpful to know what's in pregnancy teas since so many of our moms are on them. So red raspberry leaf tea is probably the safest herb that we know in pregnancy. There's just a lot of good safety data there. Otherwise, none of the tea companies would feel comfortable sticking it all on their pregnancy teas. So it has a very normalizing effect on the uterus. So if the uterus is particularly taut, it helps relax it. If it needs more tone, if it's lax, then it helps tone it up. So I think of it as a uterine tonic, but it'll also help relax it if it's really irritable. If people have a history of miscarriage, then I tell them to avoid it in the first trimester, but even that's not necessarily evidence-based in terms of having a reason to avoid it. But I think that's just worth doing so it doesn't get blamed if nothing else. And then oat straw is oftentimes in pregnancy teas. That helps strengthen capillaries, so good for good placental growth, but then also thinking about the capillaries everywhere in her body. Think about all the changes that her blood vessels are going through and the way estrogen and progesterone are causing them to be leakier, and they're needing to hold more blood, and all of those pieces to have strong capillaries is good. So that's oat straw. Alfalfa and nettle, I think of both of them as basically being a multivitamin in themselves, just super healthy. So alfalfa is a really good one, a good source for iron. That's actually something, if somebody's iron has been low in pregnancy, their hemoglobin's low, you could have them supplement just with alfalfa. But it's full of proteins, vitamin C and K, calcium, phosphorus, chlorophyll, which can help prevent anemia as well as postpartum hemorrhage, so that's great. And then nettles, really, that is your multivitamin, tons of vitamins and minerals, chlorophyll's in there as well. Not as fun of one to grow in your backyard, though I have tried. You could substitute stinging nettle for spinach in any recipe. So if you're going to put it on pizza or soups and things, then the stinginess of the nettles goes away. So, in case you were wondering, well, you could make a tea. If you're going to grow it in your backyard, it's going to take over. Okay, I digress. Labor induction, castor oil is worth taking a moment to pause. This could be in, so I have a section after this where I'm going to talk about things that don't have as much research. It probably should be over there, but I feel like I see it work so constantly that I threw it on here. So we've got one study that had 47 pregnant women. Half were given castor oil, half weren't. And then they looked at who went into labor within 24 hours. And of those that didn't get castor oil, 4% went into labor, and of those that did get castor oil, 54% went into labor. So that's pretty great. Yep, extra considerations around castor oil. I'll basically let you guys cover that when you get to intrapartum. But just to know that we do have some decent research around that. Great. Menopause. Dietary soy has actually been shown to be more effective than taking supplements of soy, so getting it in their diet. What first started the research around that was just seeing how menopause symptoms were so much milder in women living in Japan and China and Korea, and they're getting a lot of soy naturally in their diet. So thinking about edamame, soy sauce, all of that, and tofu. So dietary soy does show a lot of promise in research studies, so that would be something you could recommend. I would avoid it if they've got a history of breast cancer or a particularly increased risk for breast cancer, but otherwise it appears to be safe and hasn't. There's actually been a couple studies that are pretty big looking at women who've had breast cancer and then reviewing their diets, and it didn't look like that showed any correlation, but all the same just to be safe, since it has estrogenic properties. And then, let's see, I'm going to say something else about that. Oh, red clover. So red clover, I'll just talk about next because both red clover and soy have estrogenic properties. So basically, with red clover, smaller studies have shown a decrease in both hot flashes and the overall intensity of menopause. So I put the question mark there because we could sure use some more research, but the research we've done is really promising that it was statistically significant and is helpful for menopausal symptoms. And then for black cohosh, that's been shown to be really helpful for mood transitions around menopause, particularly with depression and anxiety. And then for vasomotor symptoms, there was a reduction as well. The one study I'm thinking of particularly, it was an 11% reduction, so not huge, but some. And then there have been a couple case reports of possible hepatotoxicity with black cohosh. So I think that's one to approach cautiously, especially if you have somebody already at risk. Yep, so I'll leave that at that. Okay, so that's my women's health page, and then just briefly, a little bit more primary care, broader. Again, these are ones where we've got a lot of good research behind it. Depression, St. John's wort. So that has been shown in multiple randomized controlled trials to be effective for mild to moderate depression. If it's severe, it's probably not going to be good enough to touch it. But if it's mild to moderate, and it's used short term, so think maybe 6 weeks, then that has shown to be helpful. Some studies were showing it even as effective as SSRIs, but with fewer side effects. So you can avoid some of the side effects associated with SSRIs. And then I already mentioned it was on our list for being a no-no with warfarin, and there's a few others on there too, but the one I want to particularly highlight is that when St. John's wort is given alongside an SSRI, they're increasing the risk for serotonin syndrome with the SSRI. And that's one where it's not uncommon for patients to be starting it themselves. So maybe you've started them on Zoloft or whatnot, and then they've self-initiated St. John's wort. So I think that's even worth asking about. If you're going to be giving an SSRI, they shouldn't also be on St. John's wort. It's one or the other. And then kava has good, there's decent research around that with anxiety. There is potential for hepatotoxicity with kava as well, maybe even more so than some of these other ones. And so I think that's one to kind of approach cautiously, but potentially consider as well. And again, a handful of drug interactions. So make sure to cross-reference that if you're going to use it. And then I mentioned cranberry extract because that has been shown to be helpful in UTI prevention. A little bit mixed, but for the most part, yes, it is helpful for UTI prevention. But to date, we haven't been able to see it help treat a UTI. So I think that distinction is good to know. Breast cancer prevention, all the good flavonoids in grapes. And you see that carried on to people recommending wine. So we've got that. And then cardiovascular disease, good solid research behind fish oil, green tea, and echinacea, possibly echinacea. And then with that, I'll just say that's secondary prevention. So they already have some kind of a diagnosis, but we're helping it to not worsen. And then common colds, all of these I would say are a little bit lighter on the research in the grand scheme of things, but definitely research out there to show that it's helpful. There's some stipulations with it, like both zinc and echinacea. You've really got to start it towards the very beginning of the cold for it to make a difference, but zinc can shorten the length of a cold. So making sure you're starting it right away, though. Vitamin C, that evidence is strong. Osteoarthritis, we've got glucosamine and chondroitin. And then traveler's diarrhea, we've got probiotics for prevention. So these are helpful for preventing as well. All right. So limited to no research, but worth mentioning. Most of these do have some research, so that's why they're on this list. But Dong Quai for okay, so first let's talk about dysmenorrhea, because I didn't even have dysmenorrhea on the other slides, because none of these quite made it up to getting to be on that list. But Dong Quai has been used forever in China and Japan. It has weak estrogenic activity, and it looks like it antagonizes prostaglandin synthesis, which is exactly what we're looking for dysmenorrhea, and that's how NSAIDs are working as well. So we know that that's basically how it works, but basically both Dong Quai and cramp bark, we just don't have any studies. So if you're looking for your PhD project, maybe that's your PhD project. But Dong Quai's been used forever for a lot of different reproductive health concerns. So I didn't want to completely dismiss it by not mentioning it because it's very popular among providers. And then cramp bark and black haw, they're both smooth muscle relaxants. So kind of thinking about how magnesium can be helpful for dysmenorrhea, though that one is, I could have added magnesium to this list too. So magnesium, cramp bark, black haw, all of those are smooth muscle relaxants, and that's how they're helping. Rose hips, I think, could almost bump to the extra effective list. There is research indicating that there is less pain and improved psychological well-being, but that study was only done in adolescents, so the general community has a hard time extrapolating that for everybody, but it looks like that actually does hold a lot of promise. So that could be a couple cups of tea a day. Rose hip tea is nice, or you could take it as capsules. And it has a lot of antioxidant potential, and we're thinking that's how it's working. And then lastly for this list, I've got guava. And then guava, basically it's an antispasmodic, antioxidant, and anti-inflammatory. And it has been shown to reduce menstrual pain compared with NSAIDs. And the benefit there is that they don't have the GI side effects that NSAIDs can have. But again, we just don't have a whole lot of research yet. But both guava and rose hips do have some research, which is great, and we're headed in the right direction, just not quite enough to fully mainstream it. And then just so you know what else is out there, so you're familiar if you're seeing it on packages or if clients are telling you that's what they're taking. It's always worth it to ask why they're taking it, even though if you're pretty sure you know why. But if they come in saying they're on false unicorn, like, oh, is that for your dysmenorrhea? And you might just impress your patient. There you go. And these are just don't have enough research or no research. Okay, so labor induction. Basically, there's just not been any studies done, but these are the most common herbs you'll see associated with labor induction. If you're going to use herbs, this is what you're going to use. And a fair number of CNMs recommend them too. There was actually a study that ACNM did a survey to see how many recommended herbs for labor induction, and just about, I want to say about half, maybe a little less than half, or right around half, were saying black and blue cohosh. If they recommend something, that's what they're recommending. Of note, blue cohosh actually has a couple case reports that involved perinatal stroke and myocardial infarction of a newborn. So on the whole, this is just not recommended. Not that we could necessarily link that bad outcome to the blue cohosh, but because that's on the table, that's not recommended. And in black, we really just don't have any studies. But given how long they've been used for this purpose, I have no no doubt that they're doing at least something. I'll actually just add, at Bethel, there's a professor in the human physiology department. I guess she's in the biology department, but she mostly teaches human physiology. And she had biology students as their big projects doing research on mice uteri. They extracted mice uteri and suspended it in liquid, and then they were grinding up different herbs and adding it to the liquid and stimulating the uterus and seeing. Well, actually, they had little electrodes attached to these mice uteri, and they were seeing to what extent it was affected by whatever they were adding. And I was actually, she was asking for some input in terms of how the research she was doing might be utilized in the general community. And so I threw some more herbs for direction to try, and definitely black and blue cohosh made the isolated mice uteri contract. And I also had her compare it with Pitocin and Cytotec, and maybe you'll see that article come out soon. We'll see. So we're still working on it. But they definitely were effective, as was castor oil. Actually, that article should just about be out, because we sent that one in. Anyway, sorry, I'm digressing. All that to say, at least on an isolated mice uterus, we know that it's effective. Does that mean that it's safe? Obviously, we're not administering it to a whole system of a mouse, and then from there you go to a whole human, and does that cross over? So that's definitely not, I don't know, you know what I'm saying. You got to take that with a lot of grain of salt, because it's a lot of steps from being ready to recommend. But in terms of efficacy, there's got to be something there. Okay, moving on. Menopause. Flaxseed and sage, I think, are the ones that are worth mentioning, because we actually do have a little research there. So flaxseed has some estrogenic properties. Some studies say it helps, others say not so much as far as menopausal symptoms. It definitely helps lower LDLs and total cholesterol, so it couldn't hurt. Yep, that's what I'll say on that. And then for sage, sage just tends to dry you up in general. So excessive sweating, etc., it helps. And one randomized controlled trial showed that it did decrease hot flashes, and women rated their menopause intensity, and it decreased by about 43% when they took sage. More so than culinary use. Culinary use isn't good enough. So we need more research, but it looks like there's probably something to that as well. And then in the spirit of understanding that sage dries you up, that's also something you could consider using postpartum if a woman just has a really, really high milk supply, overabundant milk supply, and maybe it's hard for her baby to latch because it's like a fire hose, for example, and she's really wanting to decrease her supply. Sage would be a way to do that as well, because it dries you up. Obviously, don't start recommending that on day one of your clinical. So it takes some consideration to decide if you're going to recommend somebody should decrease their supply, but that's something you could consider. Okay, so botanical flower essences. I just wanted to bring this one up because there's one particular one that you may very well see in practice, and that's Rescue Remedy. So the way botanical flower essences work is, and oftentimes it's put under the category of an energy therapy, technically, but I think it works in this category too. So basically what it is there's a bowl of water, and flowers are added to this bowl of water, and then it's left in the sunlight for a period of time, and then it's like the essence of the flower is in the water, and then that water is what's used to make the remedies. So one example is Rescue Remedy, and I see this in labor a fair bit, and it might even be something you like to use in labor. So that's why I brought it up. So you could do like a dropper full under their tongue, or say you have somebody with generalized anxiety disorder who's pregnant, or who, I mean, this is pretty safe. Look at this, this is pretty safe. So say she's pregnant, or maybe she doesn't want to take any medications, or maybe she's just not pregnant but really doesn't want to be on medications for anxiety. This might be something she'd be interested in, and she could use it as a rescue remedy, as in she'll do a dropper full if she feels like she's really panicking, or she could add like a dropper full to her water bottle, a dropper full to her water bottle, and then just be sipping it throughout the day. So that'd be an option too. But it can help with anxiety, insomnia, and labor. I have yet to see any big research articles on this. So I'm back to the realm of I'm not guaranteeing anything for you. But I've seen it be really helpful for women in labor who are kind of having a really hard time grounding themselves in one stage or another. So that's something to consider. Okay, aromatherapy. I'm sorry, this slide looks scary. Okay, so use of essential oils to stimulate the sense of smell for balancing mind, body, and spirit. Basically, they're highly concentrated, and then usually before you give it, you're diluting it to a certain extent. So for example, if you've got the essential oil of lemon, 1 drop would be the equivalent to 40 lemons. So this isn't something where you're measuring it out by the tablespoon and feeding it to patients. I mean, it's really highly concentrated, and so give it a little bit of respect in that respect. And then because it's highly concentrated, it can be harsh on the skin. So like if, say you're going to use lavender oils on somebody's back to do a back rub in labor, you'd want to use some kind of like an olive oil or a grapeseed oil or some kind of massage oil first, and then dilute a couple drops in that little teaspoon or whatever in your hand, so that you're not putting the direct essential oil directly to their skin. But it can use topically, like what I just described, or it can be inhaled. So maybe you put a little bit on a cotton ball and put it on the pillow where she's resting in labor, and then she can just smell it that way. Or maybe you put a few drops of oil in water and shake it up in a little spritz bottle and spray it in certain areas. To the extent that you feel comfortable, you could add it to a bath. If you put a lot of oils in a bath, then sometimes they'll just rise to the top because it's oil, right? And then that could potentially be kind of harsh on the skin. So I'd say just use that carefully if you're going to do that, particularly in labor, particularly if you're going to have a water birth where the baby might be exposed to it. But especially in the context of not labor, if you have a bath and you wanted to add essential oils, a good way to do that is to add it to salts, like Epsom salts, and then that helps it disperse in the water better. So that would be fine. And then inhalation, you could also use a diffuser where you're adding like a couple drops into some water, and then it's slowly being disseminated out into the air, and you can smell it in the room. And then you could take it orally, though I'm not going to get into that here. And unless you're doing it in pill form, like say evening primrose oil, you could take in a capsule form. Generally speaking, I don't recommend taking it orally because it can be really hard on your mucous membranes. And it is so concentrated, I just don't think we give essential oils quite enough respect. Okay, so use in pregnancy. How can we use these? Nausea, vomiting, peppermint's great. Any kind of citrus is great, so lemons, oranges. Same goes for what's in their fridge. So like if you take an orange peel and then you just kind of spritz it with your fingers where you bend it in half and you see the little essential oils pop out, that can be really helpful for women that are nauseous. So just carrying around a little piece of a lemon peel and spritzing it as they need to and smelling it. Emotional changes, I've listed a few here that you could consider for women who are having a hard time adjusting in pregnancy and are feeling imbalanced. Backaches, lavender and clary sage are great. So a lot of women in pregnancy can have a hard time with that. Clary sage I'd stay away from until they're just about term, or basically term, because that can cause some stimulation of the uterus. But lavender would be great. You could do black pepper too in pregnancy, that'd be fine. Use in labor, so there's a lot you can do with labor that would be really specific, like this is going to help speed up contractions, this is going to, do a lot of really specific things around labor. My experience has primarily been to either use it to relax people or to energize people. So when you think about a labor, there's phases where, you've still got a long ways to go, and what you most need to do is rest for a while. So you help her crawl back into bed, comfy on her side, And then you use something like lavender or something like rose to just set a mood for helping her kind of calm down and stay relaxed. And then maybe it's time to start pushing, or maybe we're moving from a place of energy or of rest into a time of transition or pushing, and what you mostly need in the room now is some kind of energy. So lemon, grapefruit, orange, those are all great for energizing. Peppermint's great. Clary sage is nice too. Clary sage is really nice in labor. I particularly like the combo of clary sage, peppermint, and lavender. Those three together are really nice. And then pain, like backaches again, black pepper, jasmine. Say you've got a mom with really bad back pain in labor, you can mix a little black pepper in with a carrier oil, like olive oil or a massage oil, and then mix that up and rub it on her lower back. That can be really helpful. Postpartum. Oh, I should have added on here. Postpartum, if a mom can't pee and you need her to pee, sometimes having her smell peppermint or put a couple drops of peppermint into the toilet can help her pee. And then postpartum, so milk production. Basil can help increase milk production, and then painful nipples, chamomile can be helpful for that as well. And then use in menopause, hot flashes, evening primrose oil, fennel, geranium, and black pepper can all be helpful. Great, and this has been used again for a really long time. We think the Chinese used it first with aromatic plants to just promote well-being and create harmony, and then in incense with different types of ceremonies. Egyptians were the first ones to develop distilling it, where they were highly extracting smells. So they started with cedar wood. That was the first one to be extracted in the distillery in terms of that process. Great. So I've just listed a few here, but if this is an interest area, this is a really easy one for you independently to expand your knowledge. So there's a lot of courses that are offered as continuing education, online courses as well, that are more so designed to help clinicians increase their knowledge. Hormonal issues, PMS, morning sickness, menopause, vaginal infections, this can go a lot of different directions. And clary sage, I don't know if I mentioned it when it came up initially, but you can use it for labor induction as well. But clary sage is a good one to know as a midwife. So nice for pain control and maintaining regular contractions in labor, labor induction, but also increasing fertility. It's a good one for menstrual cramps and dysmenorrhea, amenorrhea, hot flashes, mood fluctuations. So if there's one to know well, it'd be clary sage. And the other one I didn't have on here is tea tree. That one's worth knowing too. It's really good for being an antifungal and antibacterial essential oil. So you see that one in a lot of like acne products and that kind of thing. Are there precautions? Yes. So I already mentioned my concern around the oral route, but you take that out of the equation. These are great. Yes, they're highly concentrated. Give them respect, but these can be really great. So pregnancy, want to avoid rosemary. It's an abortifacient. And then Roman chamomile, fennel, frankincense, and rose are all emmenagogues, so they can potentially cause bleeding. And then clary sage, again, can potentially induce labor, so wait till their turn. It probably won't induce labor, but if they're term, then you don't have to worry about it. Cancer, basil is an astragal, meaning that it has some estrogenic properties, so we want to avoid it if there's any kind of female cancer. And then, again, these other ones that I mentioned are also not good ones if they're related to female-specific cancer. And then cardiac conditions, peppermint and rosemary are stimulants. So if you're concerned about somebody's blood pressure or heart rate not being well regulated, then those would be ones you'd want to avoid. And then infants aren't super well studied, but tea tree and lavender do have a decent amount of research around them. Actually, there was one study where they gave babies lavender in their baths right before bed and compare them to babies that didn't get the lavender baths. And the babies that had the lavender baths versus a regular bath were much more likely to sleep that night. So I think that's a good one for new parents to know about. Or they could do a regular bath and do like a little lavender massage before bedtime. So then mind-body medicine, so guided imagery, tai chi, hypnotherapy, yoga, mindfulness, meditation, prayer, dance therapy, art therapy. I'm just going to touch on a few of those. But guided imagery, I'm going to do just a little bit of guided imagery before we're all done, so I won't talk too much about that one now because I want you to experience it a little bit. But basically, I think it's great for labor, but referring people too if they're having issues with stress or anxiety, it can help improve their immune function, enhance their mood. That'd be great to refer somebody for this specifically. Or there's a lot of resources online. So if they looked it up, they could find a few videos and just have their videos online playing to them, or buying CD sets, that kind of thing. So a lot of access for them to get guided imagery. But it can range from everything from giving you an experience where, maybe it's placing you in a beautiful setting and you're just laying there and thinking about the smells and the sights and what you're hearing, and just helps you get into a really relaxed state. And then it can talk you through issues you're having, so there can be guided imagery around different types of conditions, so workplace stress, that kind of thing, or I have cancer, that kind of thing. And then, so on the one hand, maybe putting you in a place, and then on the other hand, maybe just, and I think this blends into mindfulness too, but sitting where you are and thinking about intentionally relaxing your shoulders and intentionally loosening your fingers and sinking into the bed, that kind of thing, which I think lends itself well to labor in terms of us coaching moms too. So Tai Chi is kind of like a moving meditation. Its roots are in China, and there's been research around it that consistently shows that it helps improve psychological well-being, cardiovascular and pulmonary function, decreasing blood sugars too, improving flexibility, strength, and balance. I think of that especially for our elderly population as being really helpful, and pain management. So lots of research there. Sleep too, general quality of life. So yeah, so that's something to consider. I think I have just a short little video here for you to watch. Because for all of these, I think sometimes it's just sort of hard to know what we're talking about if you haven't seen it before. So I'll just play a couple minutes, not very long.
Picking up left, step down, foot flat, shifting weight, separate hands, adjust right thumb. Now we understand parting the wild horses mane, and it's easy for us to duplicate the other side. First, follow me.
Okay. So that's Tai Chi. And then hypnotherapy is the last one I wanted to touch on here. So it can be really helpful for women who are needing to overcome big lifestyle modifications, whether that's smoking cessation or weight loss. You see hypnotherapy being used quite a bit for birth more now with hypnobabies and hypnobirthing. So if they've been listening to CDs throughout pregnancy and practicing getting in just a really relaxed state, then that can help them in pregnancy. I think sometimes it looks almost like they've disassociated a little bit. They're just so relaxed. Or it doesn't work at all. It's one or the other. I think those that practice it in pregnancy are more likely to find it to be helpful in labor. Preventing preterm labor, it's been shown to help prevent preterm labor. Definitely any kind of mental health concern, this is something that you could think about. I think this is a good example of one where if you know a good therapist in your community, then you're more likely to utilize it, as opposed to kind of referring to the random abyss of the community. So get to know community providers. Postpartum depression, this is something you could consider too for being helpful. Breast cancer, one study found that it Actually, this came out of Vanderbilt, where I graduated from, that it helped with decreasing pain as well as nausea associated with chemotherapy. And then there are some precautions. It's good to consider that it can occasionally induce regression in painful childhood memories, can possibly surface during a session, but a certified clinical hypnotherapist would know how to help your client work through those memories to help facilitate healing. But just something to consider there. So that's hypnotherapy. Oops. Wrong slide there. Okay, so that moves us right into energy therapies. So with energy healing, that can be Qigong, which is kind of like the mother to Tai Chi, and Reiki healing touch. So Qigong is Chinese, Reiki's Japanese, and then healing touch actually came from an RN in the 1980s, Janet Menken, is who developed healing touch. But basically it's about having a sense of energy fields in the body and manipulating them by basically expressing your positive energy onto them, very loosely speaking. And this can look like just holding or hovering your hands over a patient or touching a patient. So if you have somebody that shouldn't be touched, this would be something that you could consider as well. But it's been consistently shown to improve both patient and provider well-being. This is something that if you wanted to be a Reiki provider, you could go on and continue your education for that. I would say it's distinctly different than midwifery. It's not something you just work right into your practice, but maybe in labor, but it would be something separate. So more likely somebody you could consider referring somebody to. It can be done, oops, what was I going to say there? But there's been studies around breast cancer, hormonal imbalance, infertility, sexual dysfunction, and mental health, showing that it can be beneficial. And there's no precautions. So every once in a while somebody might feel nauseous or dizzy right after a session, but that should quickly subside. Different energy healing or energy healers will explain it differently, but I did have one video here just for you to watch. One person tried to explain it better than I could.
So why does energy healing work? You live in a vibrational universe. The basis of every physical thing that you see is in fact energy. So you could think of this energetic reality, the quantum field, as the blueprint of physical reality. So anytime you are focused on changing some aspect of this quantum field, you change the physical field because the physical reality must follow suit. The reason that energy healing works, then, is that when you are introducing your own vibration, which a vibration could be a thought you're thinking, any kind of intention, when you introduce that vibration, you are causing the other person, or whatever else you're doing energy on, to entrain and resonate with the vibration which you are introducing. The law of this universe is the law of attraction, meaning that the only vibrations which can share space are vibrations which match. And so most commonly, it is the dominant vibration which becomes the vibration which all else matches. So if you are able to maintain a dominant vibration, the person's body, or the water, or the food, whatever it is that you are introducing that energy to, must come up to match that higher frequency. It must entrain with that frequency, and thus, the body can no longer be a match to those negative physical conditions which they were experiencing. There are so many energy healing modalities, and like every other profession, not everyone can agree. But the one thing everyone does agree on is that wherever the mind goes, energy flows. The most important part of energy is your mind. As you can imagine, knowing this first principle of energy work, it is incredibly important for you to be deliberate about your focus. You can't walk into the room with somebody who's having an ailment and focus on the ailment and be a match to the solution for that person. You have to hold as a picture in your mind the improved state or the process of improvement. The person's body, their energetic field, is going to match that idea which you are now focused on. So, instead of walking in the room with someone with a broken bone and putting focus on the brokenness of that bone, you want to walk in there and focus your mind on anything that is a positive vibrational state, such as the healed bone, a completely healed and healthy bone, or white light potentially. And you can focus on anything like that that will help the person resonate with that improved state. You can also focus on a process like pulling negative energy out of that bone and then suturing the bone back up. Most important thing is that you're focused on whatever you want the end result to be. You're not focusing on the problem as it currently stands. All people are capable of energy work.
Okay, I think that's good for her, but you get the idea. So she wouldn't be how everybody would explain it, but that would be how one person would explain it, trying to lump multiple things into one box. Energy healing. I felt like I had one or two more notes on that. Nope, I don't. Okay, so just manipulating chakras. There's thought to be 7 basically electromagnetic fields in the body, or centers where there's more vulnerability or power in the body. So oftentimes workers doing energy healing, they'll be hovering their hands over those areas, sort of thinking of it. I think of it kind of like a laying on of hands in terms of blessing. And I think it'd be interesting. Oh, I'll just leave it at that, actually. Okay, so reflexology can be helpful for a number of things. So I've listed them here for you as far as most common things that we as midwives would come across. So PMS, fertility issues, labor induction, and postpartum, thinking about milk production and weight loss. There's some decent research there. And then menopause, typical menopause symptoms. So if you're not familiar with reflexology, basically the idea is that there's these energy flows from certain areas in the body that connect to other areas in the body. And the feet and hands are classic examples where all those areas will be found. So both your hands and your feet, your big toe and your thumb kind of represent your head. And then where your foot, or where the toe is meeting your foot, would be like your neck. So people with headaches, sometimes if they apply steady kind of pinching pressure to this part of their toe, or that same part on their hand, kind of the meatiness of your thumb. Not describing that super well, but that can help relieve headache tension, for example. And then I think it's helpful for you to just know that the gluteal area is what it says here, but the perineum and the uterus, all of that is supposedly linked with the heel, and then kind of running up the inner part of your leg, just kind of above your medial malleolus, a bone that protrudes, kind of your ankle bone. Right above that area are linked with your uterus. So in terms of, say you're in labor and your contractions are kind of spacing out, rubbing those areas can be helpful for helping contractions pick back up again. So obviously, seeing how much is here, this could address a lot of different areas of the body. Yep, so we'll just leave it at that and keep it simple, I think. Again, a lot of these could be entire degrees, and I'm trying to cover it in a short little lecture. Okay, so just to wrap up, I want to talk about whole medical systems, which would be Ayurveda, traditional Chinese medicine, and homeopathy. So Ayurveda is really the oldest form of a medical system that we have. So some would describe it as the mother of traditional Chinese medicine too. So this is as old as it gets, comes from India, and really it's a way of living. It's not so much about, oh, you have a disease, now let's fix the disease. I think this saying puts it well. This is an Ayurvedic proverb. When diet is wrong, medicine is of no use. But when diet is correct, medicine is of no need. So very much a health promotion, holistic wellness promotion focused way of life and way of viewing the world. So it utilizes a lot of nutritional principles, activity or exercise, different types of herbs, and different types of ways to promote spiritual wellness, things like massage, Yoga connection is pretty strong with Ayurveda. Those that really resonate with yoga oftentimes also really resonate with Ayurveda because they're built on very similar philosophies and principles. Yeah, so basically, in a nutshell, you're treating people based on their dosha. So everybody can be broken down to one of three types of doshas. So you could be a kapha dosha, a veda dosha, or a pitta dosha. And then understanding your dosha is sort of like a way to set yourself up for having a recipe of life that fits well with who you are. So not everybody's recommended the same nutrition, the same activity, the same herbs. You're recommended those based somewhat on you individually and the rest based on your dosha. So, for example, with people who have more of a veda dosha, they're more prone to constipation, dry skin, busyness, and moving quickly. So if you were an Ayurvedic practitioner, your work with that person would be on helping them maintain hydration, helping them to sit still, helping train their minds with approaches like guided imagery to help them maintain a balanced health. Whereas if you were working with somebody with a kapha dosha, she'd be more likely to be overweight, wouldn't like to move very fast, so even fast walking might not be an ideal exercise for her to be able to maintain it. Pitta doshas, they're more likely to have hot flashes, so it's individualized, but then also very much based off of these dosha concepts. And Ayurveda is one where training programs range from being somewhat short to fairly long, but oftentimes require you to basically already be some type of a practitioner. So if this particularly resonated with you, you could definitely add this and incorporate this into what you do as a midwife, and it would very much fit with what you do on a day-to-day basis. It wouldn't be something completely separate. Or it could be like if somebody came in where that was already the direction that resonated with them, then you could focus more of your instructions on this. Or like I know one person who really appreciates working with somebody with an Ayurvedic practitioner, and because of that, she doesn't eat cheese, and that's made a huge difference in a lot of different areas of her life, and a lot of that was based on her dosha, for example. Okay, so traditional Chinese medicine, basically it's going to incorporate acupuncture, Chinese herbs, and Qigong, which is kind of like the mother of Tai Chi. So all of those things together, people who practice traditional medicine, they pretty much all have their doctorates. So this is like a master's degree or a doctorate degree. So this isn't something you're probably going to just add into your practice. This is something where you might refer people to somebody who practices traditional Chinese medicine. So, so I think I touched on this a little bit earlier, but basically it really is a different way of assessing, diagnosing, and treating. And a lot of that's based on different types of energy flows, and meridians would be another way to put that. And that when the meridians are all lined up, we're in a healthy state. So then if there's an imbalance to that general energy flow, then that's when maybe you need acupuncture to fix it, maybe you need Chinese herbs to fix it. Qigong is like a lot of body posture, moving, breathing, meditation. So again, that's a lot like the Tai Chi video that you watched briefly. So that'd be more the spiritual mental health side of it. So probably what I'm most familiar with would be acupuncture. And in case you haven't seen it before, it's a very tiny needle. Like this one here is supposed to be like if you're starting an IV, so it's a hollow needle, it'd be about 1/100th the size of that. So it's really tiny, and then the tip of it is dull or blunt. So it really shouldn't hurt. And then if you're working with somebody who you feel like would really benefit from acupuncture, but they're particularly needle phobic, you could utilize acupressure instead, or there's different things they can do with magnets where they're still addressing those energy flow pathways, but wouldn't need to actually insert a needle. So know that that's an option as well. And if you hear the word chi, energy is referring to chi. Okay, so most of the research that we have is on acupuncture. For, let's see, so headaches, osteoarthritis, hypertension, I mean, there's really just a lot that you could do with this as far as referring women, especially if initial traditional Western medicine wasn't working. Dysmenorrhea, there's been studies that have shown acupuncture to be more effective than NSAIDs, contraception, and heat. So really effective there. Great for pregnancy. As long as the practitioner knows that they're pregnant, you just think about the general risks and benefits. Pregnancy would be a great option for acupuncture for any kind of issue. So they're not wanting to take medications because they're pregnant, but acupuncture would be very appropriate. You just need to tell them they're pregnant so they avoid anything that could maybe put them into labor. Infertility, strong research behind infertility help. And then labor induction is definitely an option, as is turning breech babies. And I can't stress this one enough. If you've got somebody who's breech that might be headed in the direction of reversion, I know you're going to think I'm crazy, but moxibustion, or Japanese mugwort, it's an herb that ends up in kind of a dried, scrunched up form, and they burn it by your pinky toe. I know that sounds ridiculous, but bear with me. There have been very large randomized control trials, which took them a while to produce because, like in Japan, nobody's going to want to risk not getting moxibustion if they've got a breech baby because it's been used there for so long. And definitely statistically significant, you're much more likely to have a baby turn than if you didn't do this. So less likely to need aversion. So that would just be if you refer them to an acupuncturist, then the acupuncturist could then decide what needed to be initiated. So they might choose to burn the mugwort. So anyway, worth knowing as a midwife. And then outside of that for women's health, sexual dysfunction, PMS, infertility, I guess I already mentioned that. Pregnancy, morning sickness and pain, back pain, wherever the pain is, perimenopause, menopause, so a great option, especially if you've got people in the state where they're not wanting to take meds. Okay, and then homeopathy. Last slide, so bear with me. So homeopathy is about like treating like. So, for example, you could have a homeopathic remedy called Ipecac, and it would be to treat feeling nauseous or throwing up. So it seems a little backwards, but basically the way it works is whatever the substance is, it's been diluted and diluted again and diluted again and diluted again until oftentimes the end product, you can't even find whatever the active ingredient was to begin with. The idea being that that active ingredient has imprinted itself on the water molecules of what you've been extracting. And then the effect of the remedy is ultimately energetic, not pharmacologic. And because of that, because you can't even really find what you started with, it's much safer than, say, herbs or even pharmacologic agents when you're thinking about pregnancy and breastfeeding. If you can't really find it, then you should be okay. So a wrong remedy isn't going to cause harm, but a right remedy might really assist the body in healing. So that's the idea there. Generally speaking, you'll see it in these little pellet forms. You can have homeopathic remedies in other forms like tinctures and whatnot, but this is primarily how you'll see it. So like at Whole Foods or different health stores, you'd probably see a whole section that are all these little bottles full of all these little sugar tablets. So that's the homeopathy section. So potency. First off, potency isn't really saying how strong it is. It's just referring to how many times it was diluted. So with potency, there's a letter and a number. And then the letter is referring to the dilution rate, whereas the number is saying how many times it was diluted. And then a typical dose would be 3 pellets. And so say this bottle, it would say like 30C or 6C or 200C as your dose. then it wouldn't really matter if you took one of them or 10 of them at one time. You're taking 30C, if that's what the bottle says. So a typical dose would just be about 3 to 5 pellets, though. So you just do 3 pellets, and then you've taken 30C. So not how we're used to reading medication labels, so I just wanted to explain that. So in terms of what potency you pick, if you pick a low number, like a 6C, that would be for chronic issues, and then you would use a higher potency for more acute issues. Generally, birth, I see and use 200C. So you'd use a low potency. You could still use it if you want to take it more often. So maybe after the birth, you're using arnica for just general bruising and aches and sore muscles from birth. Maybe you wouldn't use the 200C. Maybe you'd use a 30C so you could dose it more frequently. So hopefully that kind of makes sense. And now there's generally 2 different approaches to homeopathy. One would be, you have this symptom, so take this remedy. So pretty straightforward. If you go to the homeopathic section in the store, that's exactly what you'll see. It will label what the problem is on the cover. It will say menstrual cramps, so you pick that bottle. Or it will say sinus congestion, so you pick that bottle. So it's very basic. Homeopathic providers, it's a lot bigger picture than that. So you can do it that way. You can just go, there's the symptom, and then I took it. But homeopathic providers are really looking at everything, like all the different symptoms you're having, and then how your emotions are interacting with that too. And then it's like they'll give you a constitutional remedy. Like you as a whole person in this time in your life, this would be the best remedy for you. And I would say for this entire lecture, I'm doing the very best I can to explain all these things well, and I'm probably not explaining them all perfectly. So probably should have put that disclaimer at the beginning, because I am not a licensed any of these, even though I've dabbled with a good handful of them. Okay, so then let's think about homeopathy in birth. Actually, I'll explain the constitutional piece a little bit in the context of Simici-Fuga and Caulophilum. So if this is of interest to you, if you wanted to be like a homeopathic provider, I think that'd probably be around like a 2-year course, so that's a little bit intense. But there are little courses you can take along the way, and there's books like this one, Homeopathic Childbirth Manual, that talk a lot about what you could do in the labor setting, because there is a lot you can do. There is a remedy for her cervix hasn't fully dilated, but she's really feeling a strong urge to push. So this is a remedy to see if you can make her stop pushing until it's time, things like that. Anyway, so Caulophilum versus Simici-Fuga, thinking about constitutional. So if you've done a little bit more research, you know for both of them, just initially, you know for both of them, but both of them help produce regular contractions. So if you've got a mom who has spaced out to every 5 minutes, and you're in a setting where homeopathics are fine and accepted, you could consider using Caulophilum or Simici-Fuga to help speed up her labor again. Or maybe you're initiating them to see if you can get labor going in the first place. So if you're not sure which one to use, you could alternate them every 15 to 30 minutes, which one you're using. But if you had a good sense of both of them and you had a mom who was really fitting one description better than the other, you could do that. So when I think of a mom who needs Caulophilum, I think of a mom who's been in labor for a really long time. She's a strong mom, but she's just really exhausted. Like your mom who's kind of like half falling asleep in front of you. But she's in labor, and she's been in labor for a very long time. We've been stuck at 7 centimeters for 5 hours, and her contractions are spaced out to every 7 minutes, and we need to keep moving, and she's just really tired, exhausted. I think of that with a Caulophilum mom. Whereas a Simici-Fuga, I think of a mom who's really anxious, who's maybe a bit more irritable in her labor, and again, we're stuck at a certain centimeter, we're not contracting as much as we need to be, or we've got kind of irregular contractions, but she's having a really hard time coping. Kind of that psychological piece is more of an issue here versus an exhaustion piece. That would be one where if you had a strong sense of the homeopathy you were using, you would be better at giving a constitutional remedy. But again, if you give the wrong one, it probably just won't work. Yeah, so that would be one example. But otherwise, it's okay to just start with, okay, this one is for fear and anxiety in labor. Let's give it a try, see if it works. I've got a 30C or I've got a 200C. I'm going to give a dose, 3 pellets, see how she does. If it looks like it's helping some, 15 minutes go by, I'm going to give it again. If it looks like that got us to where we need to be, great, we're done. If I've given it 2 or 3 times and nothing's happened, then I'm just going to back off. And I don't think that one's working for her. So that's kind of realistically what that might look like. So I put some of the most common ones you could use in the birth setting here. The home birth practice I did in Seattle, I would say 75% of our moms didn't take even ibuprofen after the birth, and they got away with just arnica. All of them used arnica, and then if they needed ibuprofen, they'd take it, and arnica was enough for basically all of them. So if that gives you an idea of how helpful they can be. So arnica is great. You'll also see arnica even just over the counter in more of like a cream form. So athletes will put it on sore muscles after they've gone running, like on their calves, for example. It's also helpful for bruising. So if you've got a baby after the birth that just has a really bad cephalohematoma, you could have parents get the same stuff you use with the athletes, where it's like a cream. Be careful not to put it anywhere near their face, but they could rub it over the skin, over the bruising, and that would help the bruising resolve sooner. As an example of arnica. So you can use arnica in labor, but also postpartum is really great. Great. Pulsatilla for moms that are particularly weepy or really needing to pull from those around them for support and comfort in labor. This can be helpful. And I've seen belladonna be great for mastitis too. So I'd wait 24 hours before starting antibiotics, but you could start this right away and see if that did it. Again, I kind of tailor this to what kind of a mom is in front of me and what's going to resonate well with her. All right, so that's the end. So as promised, I wanted to wrap up with a little bit of guided imagery. And if you need a break from me, I totally hear you. Maybe come back to this later if you'd like some. Otherwise, I'm just going to read a script, and I'd recommend maybe sitting down and closing your eyes or laying down if you feel comfortable. And you're welcome to settle into this as much or as little as you want to. So maybe start it, and if it's not resonating with you, that's fine. You can just stop. All right, I'll just pull up my script here. Begin by getting comfortable. You may want to sit or lie down. Close your eyes or focus your gaze on one spot in the room. Start to relax your body, beginning with your feet. Allow a feeling of relaxation to fill your feet, feeling heavy, loose, relaxed. Relax your ankles, lower legs, and knees. Allow the relaxation to continue, relaxing your upper legs. Let your legs completely let go. Let the muscles let go, feeling very heavy and relaxed. Now relax your hips and pelvis and all the surrounding muscles. Feel your stomach and lower back unwind, the muscles giving up their hold. Now feel this movement and relaxation in your chest, back, sides, feeling very relaxed and very heavy. Now relax your hands all the way from your fingertips to your wrists. Feel your lower arms relaxing, letting go. Now your elbows and upper arms, loose and heavy. Let your shoulders sink down, feeling them lowering slightly, finding a comfortable, relaxed position free from tension. Allow the muscles of your neck to relax, letting go. Relax your face and head. Feel your entire body relaxing even more deeply, becoming completely relaxed, limp, heavy, comfortable. Now turn your attention inward, even more deeply inside, to find your authentic self. Begin by reflecting upon your values. What is the most important to you in life? What do you value? Where does your sense of right and wrong come from? Spend the next few moments thinking about your values. The values you've been thinking of make up part of the core of who you are. If you're being true to your values, these core beliefs will drive your behavior. It feels good to behave in ways that are consistent with your values. For example, if honesty is something you value, this could be reflected in your life by being truthful. If you value your family, perhaps your life reflects this in the time you spend with family members. Think about how your values can be part of your day-to-day life. Now consider what else makes you who you are. Finding your authentic self involves learning who you truly are. Your authentic self is the real you, the person you're truly meant to be. Your authentic self is the person you are at the core, the person you can be if nothing holds you back. Imagine the person you believe yourself to be right now. It's okay if you aren't quite sure who you are. Just picture yourself going about the things you usually do in a typical day. Imagine that you're watching yourself, observing yourself going about your usual activities. See yourself getting up in the morning, going about your day. Imagine the things you do in a typical day. Picture this person you standing in an empty room. Imagine watching this person. Observe. Now imagine you could strip away all the things that hold you back from your full potential. Imagine self-doubt dissolving, being replaced with confidence and self-assurance. Picture this person before you and imagine all the things that get in the way of success. Circumstances, lack of resources, lack of forgiveness, illness, baggage from the past, anything that is holding this person back in any way at all. See these problems dissolving, disappearing, going away. Imagine you see a stream outside the window of this empty room. All of these issues that are holding you back, your full self back, imagine tossing them out the window and watching them go down the stream. Now imagine this person standing in the empty room. What is left? Who is this person when all those barriers are stripped away? This person is you. Imagine who you are at the core, the pure character that is left when there is nothing to get in the way of complete self-appreciation, complete self-expression. You may only have a vague picture in your mind right now. Let's allow that picture to come into focus, becoming more clear. Think of your motivations. What motivates you? What drives your behavior? What catches your interest, or has caught your interest in the past? What propels you to action? Think about your personality and character traits, the characteristics that are left when all barriers are removed and all fears have gone away. At your fullest potential, your simplest form, with no fears, what traits do you have? Think about your energy. Are you laid back and calm, or are you energetic? Think about your other characteristics. Are you introverted or extroverted? Quiet or talkative? Are you creative? Practical? What sorts of things do you appreciate? What do you admire? What do you like? Imagine something that makes you feel happy. What is it? Think of some things you enjoy, things you like to do. Think about all the characteristics of the person who is left when all barriers and fears are removed. Now let's create a different picture. Imagine yourself as a young child in a happy moment. See the potential in this child. Who is this young person? What makes this child who he or she is? Think about the characteristics that you share with this child. In what ways are you similar? In what ways does the current you differ from this child? Think about how you have learned and grown since the time you were a small child. Now picture yourself as the child. See the world through your younger self's eyes. What did you want to be when you grew up? What hopes did you have for your future self? What dreams did you have as a child? The hopes and dreams you had as a child were probably related in some way to your authentic self. Something about your dreams was connected to a part of your true self. What do these aspirations say about who you are? What personal characteristics of yours are related to your childhood dreams? For example, if as a child you dreamed about becoming an astronaut, you probably have some personality traits that relate to this dream, such as being curious, adventurous, analytical. Think about your own childhood dreams and see what these dreams say about who you are. Now create one final picture in your mind. Imagine in as much detail as you can the person you want to be. Imagine your ideal self. How would this person behave? What does this person, your authentic self, value? What motivates this ideal self? What personal characteristics are present in this ideal version of you? Imagine all the details of the person you most want to be. image in your mind right now of this ideal person is you. This is your authentic self. This is who you are. At the core, beneath all of life's getting in the way, this is you. Spend a few moments with this image of your authentic self. Now allow yourself to step inside this image and fully become this person. Become who you are. For this moment, just be, simply be your authentic self. Feel a sense of calm and serenity, secure in who you are, knowing who you are. This is you, your authentic self. You can take this authentic self with you, allowing this true essence of you to shine through in everyday life. Allow your values, personality, and motivations to shine through, to guide your behavior, to make up who you are. You've always been this person, and you will always be your authentic self. A positive, confident person, a person that you like and you appreciate. Underneath the challenges, the baggage, the demands of living life, this is the real you and will always be with you. It's time to reawaken now. To conclude this relaxation exercise, keep the image of your authentic self with you as you go about the rest of your day. Express this true self and allow you to simply be you. Wiggle your fingers, waking up your hands and arms. Move your toes, allowing your feet and legs to wake up. Feel your muscles reawakening and your whole body filling with energy. Open your eyes and sit quietly for a moment while you reorient to your surroundings. When you are completely awake and alert, you can return to your usual activities, feeling confident and calm and in touch with your authentic self. And now to close, I want to read a passage out of Philippians 4. Rejoice in the Lord always. Again I will say rejoice. Let your reasonableness be known to everybody. The Lord is at hand. Do not be anxious about anything, but in everything by prayer and supplication, with thanksgiving, let your requests be made known to God. And the peace of God, which surpasses all understanding, will guard your hearts and your minds in Christ Jesus. Finally, brothers and sisters, whatever is true, whatever is honorable, whatever is just, whatever is pure, whatever is lovely, whatever is commendable, if there is any excellence, if there is anything worthy of praise, think about these things. What you have learned and received and heard and seen in me, practice these things, and the God of peace will be with you. Have a great week, guys.